Namaste. This is Dr Vidyasagar Panchal, Sanatana Ayurveda Specialty Clinic, Umdavat. I welcome you back in Sanatana Swadhyaya. So after a long time, we are making another video in the series. So today we are going to discuss one of the very important kalpa in Ayurveda, that is Sanjivini vati. In the last videos, we have discussed about the Ananda Bhairava Rasa and Arvinda Asava. So this time I thought we will discuss a vati so that you will be benefited how to know how to study each and every kalpa. So in that today we are going to discuss about especially on Sanjivini vati in more detail. So in Sanjivini vati, the first of all we get the reference in Vaishajya Ratnavali. So first we have to see the shloka. So for that, Vidangam Nagaram Krishna Pathyam Pathyamala Vibhitakam Vacha Guduchi Ballatam Visham Cha Atra Yojayet. So these are the main ingredients. So each and every ingredient, if we see, they are Vidanga, Nagara, Krishna, that is Pippali, then Haritaki, Vibhitaki, Amalaki, then Vacha, then Bhallataka, that is Shodhita Bhallataka. So Visha, here it is Vatsanava. So in any kalpa, when we study, we have to see some important points such as, I also discussed these points before also, but whenever we see a particular kalpa, see whether if there is any Vishadravya in that particular kalpa. Are there any Upavisha or Vishadravya? Then see whether there is the kalpa is totally a herbal or herbo-mineral combination. And some other important things we will discuss further. So this kalpana is mainly containing Vatsanava and Bhallataka, which are dominating in the kalpana. So Vatsanava and Bhallataka both are Tikshna, Ushna, Vyavayi Vikasi properties, and they are Kapha Vatahara in special in nature. So the entire kalpa is Kapha Vatahara in nature. So while giving it to a patient of Pitta Prakriti, please be careful and avoid giving this kalpana in Pitta Prakriti. So this is the kalpa, and these ingredients are given bhavana with gomutra, that is gomutra bhavita. So which again increases the potency of this kalpa, and it becomes more deepana, pachana, more vishagna, and more antibacterial in nature. So where to give this kalpa? So Sanjivini vati, as the name itself indicates, it's just like the Sanjivini. It's like a boon to the humans. So Sanjivini vati, mainly it is indicated in Agnimandya, Ajirana, Shula, Pradhana conditions. So you know the condition where there is Agni is Manda and the patient again continues taking Atyadika Ahara, Vishamashana, Adhyashana, Bhuktasya Upari Bhuktam, Adhyashanam Smrutam. So when the person continues Adhyashana, continuously eating, so that causes Agni Mandya, and before the Agni itself is Manda and the person continues Adhyashana. So it causes, there is Ama, so Amajanya Aneka Vyadhis will start coming. So in that, one more condition is Visuchika. Suchibirva Gatrani Vidyati Visuchika. The person feels pricking type of pain in the abdomen. So that kind of condition, where there is Dravamala Pravritti, and repeatedly Mala Pravritti along with pain, the colicky pain in the abdomen, and followed by the stools, semi-solid stools, sometimes liquid stools. So such conditions, Sanjivini vati works very well. Another condition is Jvara, where there is Kapha Vataja Jvara. The person is feeling heaviness in the body and continuously fever is there, and there is Sveda Avarodha. So as Vatsanava and Bhallataka are present in this kalpa, this becomes a very best and very beautiful Svedala in nature. So this kalpa can be given in Jvara Adhyaya. So whenever there is Amajanya Jvara, this kalpa is going to be beneficial, but keep this in mind. Don't give this kalpa in Pittaja Prakriti or Pitta conditions. And one more thing is, when you see the Falashruti of this kalpa, they have explained very beautifully. That is, Ekam Ajirna Gulmeshu, Dvav Visucham Pradapayet, Tisrascha Samsarpadam Shretu, Chaturthe Sannipatike. That is, how to give this kalpa in particular diseases. So, Ekam Ajirna Gulmeshu. If you want to give this kalpa in Ajirna and Gulma conditions, give one tablet. Dve Visucham Pradapayet. That is, if there is the condition is Visuchika, give 2 tablets. and give 3 tablets in Visha, that is Sarpadamsha like conditions, and 4 tablets in Sannipataka Jwara or Sannipataka conditions. So that should be kept in mind whenever is there any specific things the Acharya is explaining in that particular yoga. Those things also have to be kept in mind. So this is how you evaluate a particular yoga and where to give. So each and every ingredient of the yoga you must go through. That is Vidanga, which is Krimigna, Deepana, Pachana, Ushna Virya Dravya. Then coming to Nagara, Shunthi, this is Amapachana and Chvaragna, and also Deepana, Srutoshodhana. Then Krishna, that is Pippal, is Vatahara, Balya and Brahmana also. And coming to Pathya, that is Trifala, that is Trifala, Kashaya Rasa, Tikta Rasa, and Deepana, Anulomana. Then Vibhita, that is over Trifala. Then Guduchi, Jvaragna in nature, Tikta Rasa, Tikta Kashaya Rasa, Deepana Pachana. Then Visha, that is Vatsanabha, and Bhallataka. So Bhallataka Kalpa. So not only in Ajirna and Agnimandya or Gulma like conditions, also this yoga proves to be beneficial in the Amasya Udbhava other rogas such as Shvasa and Kasa also. So I have given this Kalpa in Shvasa and Kasa where the Vyadi is Amasya Udbhava. So in such condition also this yoga is going to be very beneficial. And whenever there is the condition which having pain along with stiffness, pain along with heaviness of the body, so and there is no involvement of the pitta, such conditions also this kalpa is going to be beneficial. So the overall, if we see this kalpa, it becomes Agnidipana, Pachana, Krimigna, Srotoshodhana, Jvaragna, Svedala, and whatnot. So this kalpa becomes just like the name indicates, Sanjivini. So whenever you see the hetus of Santarpana Janya, hetus of Kapha Pradoshaja Janya, and hetus of Sroto Avarodha, Santarpana hetus, where there is, you will not get any Pittaja hetus. So in such conditions, you can prescribe Sanjivini Vati. And this contains Visha and Bhallataka. So before giving, please evaluate there is no any influence of Pitta in a particular disease. So this is about some basic informations about the Sanjeevani Vati. So in the next video, we will come across with some new formulation. And till then, take care. Thank you.